Did you know that colon cancer is the second leading cause of death from cancer worldwide? Many symptoms accompanying this cancer go unnoticed until it's too late. Fortunately, you can catch this silent killer early by paying attention to specific changes in your body or a loved one's. This video will uncover critical colon cancer symptoms you should never ignore. We will walk you through the subtle signs your body may be sending and why you must pay attention to them. But that's not all. We will also show you the risk factors that can worsen this condition and how to prevent and manage it. Stay with us throughout this video, as doing so could be the difference between early detection and a life-threatening situation. The information we're sharing with you today can save your life or that of a loved one. What happens in the early stages of colon cancer and how is it initiated? Contrary to popular belief, the symptoms of colon cancer often go unnoticed for years. In the early stages of colon cancer, the disease develops from abnormal growths called intestinal polyps. These small clumps of cells form on the inner lining of the colon or rectum. The formation of intestinal polyps begins with genetic mutations in the cells lining the colon. These mutations cause an overgrowth of cells and disrupt their normal life cycle, leading to a slow accumulation that forms into a polyp. This silent growth makes it easy for the disease to go undetected in its early stages when treatment is most effective. Studies show that 50% of people diagnosed with colon cancer only notice symptoms in the later stages of the disease. People often overlook colon cancer symptoms because they can be mistaken for other common digestive issues. Abdominal pain and cramping, changes in bowel habits such as diarrhea or constipation, and persistent gas are all signs of an upset stomach or irritable bowel syndrome. However, it's critical not to dismiss these symptoms if they persist or worsen over time. Another factor contributing to the silent nature of colon cancer is that it often develops without causing noticeable changes in weight or overall health. We associate weight loss with advanced stage cancers, but colon cancer can hide beneath the surface without significant impact on body weight until it graduates to the advanced stages. Regular screening tests such as colonoscopy are crucial for early detection and prevention. How do intestinal polyps lead to colon cancer? While most polyps start benign, meaning they are not cancerous, other types have a higher chance of becoming malignant with time. Adenomatous polyps are particularly concerning as they usually progress into cancer if not removed during routine screenings. These cancerous cells are why early detection through regular tests is critical to identify and remove potentially harmful polyps before they develop into full-blown colon cancer. What are the risk factors of colon cancer? Colon cancer is prevalent among the older population starting from age 49. The age bracket beyond the age of 65 accounts for more than half of all cases of colon cancer. As the years go by, the rates of colon cancer increase among older adults and young individuals. This alarming trend has left many wondering why this is happening and how to prevent it. A possible explanation for this increase is the changing lifestyle patterns that have emerged in recent decades. In today's fast-paced world, processed foods and sedentary lifestyles have become the norm. Regardless of age, many people consume diets high in processed sugars, unhealthy fats, and low fiber, all of which contribute to a higher risk of developing colon cancer. Technological advancements have led to a more sedentary lifestyle with less physical activity in our daily routines. The lack of exercise and poor diet create an environment conducive to this deadly disease. Moreover, smoking and excess alcohol can even worsen the condition. Research shows that smoking and taking alcohol can increase the risk of colon cancer by 30%. A common belief is that your genes can determine your susceptibility to colon cancer. While it's true that genes or family history can increase your risk of this condition, recent research shows that genetics only play a small role in determining your risk for colon cancer. A mere 5 to 10% of all cases are linked to inherited gene mutations. This finding implies that most colon cancer cases occur in individuals without any family history of the disease. So, what does this mean for you? It means even if you don't have a family history of colon cancer, you should still be vigilant about understanding and recognizing the symptoms. Early detection and treatment can improve outcomes for those with colon cancer. So, without delay, let's dive into the early warning signs of colon cancer. Changes in bowel habit is the foremost symptom of colon cancer. As polyps grow, they can obstruct or narrow the passageway through which stool travels, leading to changes in stool consistency. In some cases, colon cancer may cause constipation. These lumps block the colon partially, making it harder for stools to move through. Some people may experience diarrhea as a result of colon cancer. When a tumor obstructs the passage of waste material through the large intestine, liquid stool builds up above it and can leak around it, causing episodes of diarrhea. This cancerous cell buildup can produce substances that affect gastrointestinal motility and water absorption within the intestines. These substances can interfere with peristalsis, the rhythmic contractions that propel stool along and lead to irregular bowel movement. Whenever you notice blood in your stool, especially if it appears dark and sticky, it can signify a potentially serious condition such as colon cancer. Blood in the stool is often due to bleeding in the digestive tract. In the case of colon cancer, the tumor growth can cause ulcers or polyps within the lining of the colon or rectum. When these ulcers or polyps bleed, they release blood into the stool. Subsequently, colon cancer can lead to rectal bleeding due to the tumors that form in the colon. These tumors can damage the blood vessels, leading to bleeding during bowel movements. In some instances, rectal bleeding may be one of the first signs of colon cancer. It often starts as bright red blood on the toilet paper or in the toilet bowl after a bowel movement. The presence of blood indicates something is wrong with the digestive tract, and you should consult your doctor immediately. Besides, when polyps grow larger and become more invasive, they can obstruct or narrow the colon's passage. This obstruction disrupts regular bowel movements and can contribute to rectal bleeding. Considering the fact that tumors form in the colon, this area may bleed slowly over time. This chronic bleeding leads to long-term iron loss from the body, as iron is essential for red blood cell production. As a result, individuals with colon cancer may experience a gradual decrease in their hemoglobin levels and develop anemia. Anemia occurs due to insufficient red blood cells in the body to carry oxygen to the tissues. This lack of oxygen can lead to fatigue, weakness, and shortness of breath. Tumors can also block the large intestine, intensifying pain in the abdomen. As the tumors grow larger, they obstruct the passage of stools through the colon, causing a backup of waste material and discomfort. These lumps increase inflammation and irritation in the abdominal area as the cancer spreads to nearby tissues and organs. This inflammation can lead to sharp or cramping pains that persist for extended periods. Not all cases of abdominal pain indicate colon cancer. However, never ignore persistent or worsening pain. If you experience unexplained abdominal discomfort accompanying other symptoms like changes in bowel habits or rectal bleeding, that could be a sign of colon cancer. Seek medical attention promptly to ensure an accurate diagnosis and appropriate treatment. Weight loss is a positive outcome when trying to shed those extra pounds, but sudden and unexplained weight loss may prompt concern. Colon cancer can lead to weight loss in a few ways. The tumor can interfere with the normal digestion and absorption of nutrients in the intestines, leading to malnutrition and subsequent weight loss. Besides, it can enhance metabolism. Cancer cells consume a lot of energy, increasing metabolic rate. Heightened metabolic activity affects normal bodily functions and burns calories faster than usual. As a result, even if a person maintains their regular eating habits, they may experience unintended weight loss. How can you detect colon cancer early? Colon cancer is a life-threatening disease that often goes undetected until it reaches an advanced stage. However, the chances of successful treatment and survival increase significantly with early detection. One of the most effective methods for detecting colon cancer earlier is colonoscopy. What is a colonoscopy? During a colonoscopy, experts insert and guide a flexible tube equipped with a light and a camera called an endoscope into the rectum through the colon. The doctor can then visually examine the entire colon length to identify any abnormalities or signs of cancer. In addition to visual inspection, they also take tissue samples for further testing if necessary. They use anesthesia on patients while screening to ensure comfort. Some patients report not feeling anything during the process, while others can't remember any experience from the procedure. So why should you consider getting a colonoscopy at least once every 10 years? Apart from its ability to detect early-stage colon cancer, this procedure has other compelling benefits. It can help identify precancerous polyps, abnormal growths in the lining of the large intestine that can eventually develop into cancer if left untreated. Removing these polyps during colonoscopy reduces the risk of developing colorectal cancer in the future. Can you prevent and manage colon cancer with natural measures or lifestyle changes? Regular exercise is essential for optimal colon health. Recent studies show that physical activity can reduce the risk of colon cancer by up to 40%. Exercise helps regulate body weight, improve digestion, and boost the immune system, factors that maintain a healthy colon. Engage in physical activities such as walking, cycling, and swimming to improve colon health and prevent cancer. In addition to exercise, making dietary changes can help ensure a healthy colon by killing cancerous cells. Consume a diet rich in fruits, vegetables, whole grains, and lean proteins to supply essential nutrients and fiber for optimal digestion. These foods are rich in antioxidants that prevent the growth of harmful cells. Fiber-rich foods promote regular bowel movements and absorb toxins from the intestines. Turmeric is a powerful spice that can inhibit the growth of precancerous cells in the colon. Incorporate these lifestyle changes into your daily routine to reduce your risk of developing colon cancer significantly. Don't forget to go for regular checkups beyond age 45. The U.S. Preventative Services Task Force recommends this due to the hard-to-detect nature of colon cancer in its early stages. Besides, consult your doctor if you experience any of the symptoms we've discussed, regardless of age. They will examine you and guide you on the next step to take.